GI and lower bowel symptom. So if you look at the upper GI, like cancer, esophageal cancer, or stomach cancer, so that's the cancer-related problem. The other problem that especially in the UK, is regarding a systemic issue.
Dr. Vicent is from London. He has joined us especially for this event. Dr. Vicent, this question is for you. What are the estimated percentages of patients in respective stages like 4, 3, 2 and 1 of GI cancers overall at the time of diagnosis in your experience?
So thank you very much for inviting. It's very difficult to look at overall into upper GI and lower bowel symptom. So if you look at the upper GI, like cancer, esophageal cancer, or stomach cancer, you find by the time you come to any specialist, it will be stage 4 disease. Cancer, 50% will be stage 4, and then unfortunately for pancreatic cancer, percent to maybe 15% will be stage 2 and stage 3. It's extremely rare to pick up anyone stage 4 disease. Now, it is slightly different in bowel cancer, and when I say this, I'm talking about the figure from the UK experience. In bowel cancer, slightly different because in the UK, had the bowel colonic screening program. So the pickup rate is slightly higher. So stage 4 disease and stage 2 and stage 3 are relatively evenly distributed. You get quite a few stage 1 disease in bowel cancer. So that is our experience in terms of percentage.
Vicent, what is your experience? I mean, in your region, what are the causes of this? How important is the delayed presentation in, late stage presentation?
So there are, I think the panelists have already mentioned some of the causes. I would divide into 3 categories. It's obviously cancer related. So for the reason for upper GI cancer is because there are more non-red flag symptoms. They are more not as clear cut as, or someone can have passing blood in the stool. So that's the cancer related problem. The other problem that especially in the UK is regarding a systemic issue. Now in UK we have a 2 weeks wait referral pathway for all the general practitioner. Despite that, I mean we are getting non-consistent referral presentation from different GP. So despite what we try to do, we have a good system within this England. There is still variation in some of the care. So therefore, the referral to specialists is delayed. Number 3 is patient-specific factors. So patient might not actually aware of the disease. They were not aware that changing bowel habit is actually something abnormal. And the other group of patients is they actually deny what are the disease. They don't want to hear Asia and Oriental population. We are more averse on negative news. The other thing that we in London, for example, in the east side of London, there are more social deprivation. When it comes to social deprivation, then the late presentation is more common, and that is what we experience in the UK.